Hello and welcome to the Philippines. The doctors and medical system here in the Philippines is different than what most of you are probably familiar with. So I'm going to relate a couple of my experiences that I've had recently, and it started at Chunghwa Hospital in Mandaue City, Cebu, the Philippines. This Chunghwa is quite new and clean and laid out very nice. There's another one near Fuente Circle down by Robinson's, down by the capital area. I'll show you a little bit about that later. And one thing nice about hospitals in the Philippines, you can usually go directly to a specialist if you know which specialist you need, a lung specialist, or that type of thing, a dermatologist. You don't have to go to a general practitioner first to get a referral. And I came down here for a couple of reasons. I wanted to get a blood test because I had a couple marks on my leg that were there for like 2 weeks, and I thought maybe I'd been bitten by something. I should get checked, and so I was down here to get a blood test, number one. Secondly, I am fair-skinned. I got sunburned a lot in my younger years working on our farm in the USA, and I am therefore susceptible to skin cancers, and I need to get checked every year or so for that. So that time is near. And I never did find a dermatologist here. They don't have a dermatologist in this hospital yet. They sent me to the Chunghwa down near Osmeña Fuente Circle instead. I did stop in the outpatient office here, and they brought me right in. They had everybody else, which really surprised me, and suggested that I go see a surgeon instead. Any bite, dog bite or insect bite, they said you need to see a surgeon first. And I explained to them that I didn't want any surgery done. I just wanted somebody to take a look at it and get a blood test. But anyway, I never did get my blood test. The ladies at the laboratory thought I should sign up for a battery of tests that were going to take about 10 hours or so, and I wasn't going to do that. The cost of that would have been a little over 5,000 pesos, a little over $100, but anyway, I didn't do that. I went on to the Chunghwa at Osmeña Fuente Circle. This is a look at the executive health unit where they set up a number of laboratory tests for you to take. It would take from 2 to 5 hours, and you can even schedule it for an overnight if that's more convenient to you, depending on which set of tests and program that you sign up for. They've got package deals on a number of different types of tests, and other hospitals offer similar type things, I believe. Here's a look at the food court. Now, keep in mind, one of the reasons that many people, especially retired people, live in the bigger cities is because of access to the bigger and better hospitals, and that's true of Cebu City. And Chunghwa is one of the top-rated, if not the top-rated hospital here in Cebu City. Many foreigners live in the Makati area of Manila because there are several hospitals in that area as well. There is Chunghwa Hospital near in the background near Fuente Circle, Capital Region in Cebu City. And then there's the Medical Arts Building, two buildings there. And that's where I was directed. I was given the name of two dermatologists and their room numbers there. So this is just a little bit of a look inside, up and down a couple of hallways inside Chunghwa in the Capital Region. And you definitely get the feeling of crowds and people waiting to get into offices, waiting in turn. Most of these offices offer first come, first serve. I tried to set up an appointment, and I was told it was first come, first serve. Some places may give you preferential treatment if you're a senior citizen, and I've seen that happen. I've had it happen to me. There were 20 or more people waiting in the dermatologist's office and outside their offices when I arrived here in the afternoon, so I put off seeing a dermatologist today. One thing you'll find if you are, or even using the elevator, I took the stairs, one thing you'll find if you're hospitalized is nurses don't look after you like they do in the USA, and I'm not sure about the rest of the world, but you generally need a helper or somebody, a family member there, in case you need medication, need anything from outside. If you need pills, if you need some sort of shot, like a tetanus shot, you need to go down, or you need to send somebody down to a pharmacy to buy those items, bring them back to your room so the doctor can administer them. So you need to hire a helper, oftentimes a off-duty nurse. They're always looking for extra help, extra money, or bring a family member or friend with you to take care of you, to bring you food, buy your medicine for you. At this point, I had given up on the blood test and seeing a dermatologist today, so I went and found a doctor the following week at the ILS Center, basement level 2, and I was given priority because I'm a senior citizen. I was brought in immediately after signing in. It took me about 10-15 minutes consultation. Cost me 700 pesos, about 14 US dollars. And the different doctors work different shifts, different hours, so you should be aware of that. You might want to check in and take a couple pictures of that schedule if you're in the area. He wrote me prescriptions for antibiotics, X-Phlegm, Zycast, antihistamine, and some ointment for my skin. I've had some discoloration I thought might be skin cancer. It's not skin cancer, fortunately. One thing you'll find in the Philippines is that, like in the U.S., you've got medical clinics, doctors' offices in many even smaller little towns. Here, if you ask where you can find a doctor, most people will tell you, go to the hospital, sir or ma'am. That's been my experience, and I've found a couple little offices walking to the hospital. This was a good find, to find an office inside of a mall. The office calls I've had in the past range from 300 to 400. This was 700. It was very well worth it to get in, get my prescriptions, get out of there, and I'm happy to pay 700 pesos, 14 US dollars for that service and convenience. If you're going to live outside of the bigger cities, you're going to have more issues with finding these services at the hospitals, finding doctors that can perform special types of tests, equipment, and all that type of thing. You're going to probably have to come to the bigger cities to get that done, so keep that in mind. Thank you for coming along. Please like, share, and subscribe. Safe travels to you all, and we'll see you next time.